Begin this session today. Welcome, everybody. For those of you in the studio audience, thank you for coming, and thank you for paying attention for about, hopefully, no more than a half an hour. Certainly, if you do have a chat, you can drop us a note, and somehow Don will see it, because I probably won't. And also, if you're a new employee seeing this for the first time, I say good morning to you and welcome to Medical Health Associates. So let's get started. This is a presentation about the 8 Elements Compliance Plan, also known as Medicaid Fraud, Waste, and Abuse. My name is Chris, and I'll be your moderator for today. So why is this program mandatory? Well, frankly, it's the law. We're required to do this at least once a year after your new employment. And ultimately, because we're all responsible for protecting the finite resources paid by taxpayers through the federal and state governments for health programs. The government expects us that we're going to do our part to help these funds be used appropriately and legally. As such, we're going to ask you at the end of the program to sign a code of conduct that includes that you viewed this program and then you appreciate the importance of this program. So the goals for today, to review and refamiliarize all of us to our obligations about following the rules and regulations relating to and participating in the government programs such as Medicaid. We're going to discuss the difference between fraud, waste, and abuse and how it relates to the services that we perform. And the hope is that you leave knowing that we're all on the same page to protect the finite funding resources for these healthcare services. So why talk about this again? Every year, and this is true, billions of dollars are appropriately spent for fraud, waste, and abuse. It affects everyone, including you. This information is, the hope is that it'll detect, correct, prevent fraud, waste, and abuse, and for you to know where to report it if you encounter it. Combating this fraud, waste, and abuse is everyone's responsibility, so let's be vigilant, protect yourself, protect our practice, and protect our patients. Are we compliant? Is Medical Health Associates compliant? Of course we are. But we have to keep in mind that every activity that we do is subject to scrutiny retroactively by the government. They have the ability to look back and see if they agree with how we performed. What you're looking at right now is a letter from January of this year for monies that are being requested back by a doctor out of Liverpool, New York, which is in Syracuse, near Syracuse, for $8,000 or so because they say that she inappropriately collected that money. It took 4 years, roughly, or more, 5 years, to get this letter out. So they can go back as far as they want if they detect some sort of issue, this being the state government in this case. Also, this year, a local insurance company, Independent Health, was asked to refund $255,000 because they were found that they were overpaid. And if you're so inclined, this information is all matter of public record. At the bottom of this page is the URL for the Office of Mental Health, Office of Medicaid Inspector General, who is the overseer of all things Medicaid in New York State. So, Chris, what's fraud? Let's review it one more time. The key to remember, fraud is intentional and typically characterized by knowingly submitting false statements or making misrepresentations to obtain healthcare payments, knowing, soliciting, repaying, or accepting money to induce or reward referrals for items reimbursed by healthcare programs, or making prohibited referrals to certain designated health services. What that means is if you own a facility, if you own a laboratory, an X-ray facility, or some sort of physical therapy, and you're indeed making referrals to yourself, that can come under a guise of potential fraudulent behavior. Some examples: knowingly billing for services that weren't furnished, billing more than once for the same service, misrepresenting a diagnosis just to justify the payment for those services that might otherwise not be covered, falsifying the identity of a provider for service to obtain payment. And this reminds me of the reality that sometimes what folks will do is they'll wait for a physician who has passed away and somehow get their numbers and set up their own claim shop. By doing that, they could send claims in on behalf of the expired physician and collect the money until they get caught, and then they shut down the shop and they open up another one. So it's out there. Billing for appointments that a patient failed to keep, ignoring or altering claim forms to receive a higher payment. What about waste? What's the definition of waste? Waste is overutilizing services or other practices that directly or indirectly result in unnecessary costs to the Medicare program. It's not typically considered to be criminally negligent, but rather a misuse of resources. Examples: conducting excessive office visits or writing excessive prescriptions, overprescribing more medications that are necessary for treatment, ordering excessive laboratory diagnosis tests, or not billing in accordance with recognized standards. So what about abuse? Abuse is about, well, I thought I was doing it correctly. It turns out I wasn't doing it correctly. So it involves getting payments for services when there's not really, there's no legal entitlement for that payment. And the provider hasn't knowingly or intentionally misrepresented. Ignorance is not bliss. The government expects us to know the rules. They expect us to apply those rules consistently with how we collect data and we submit claims to Medicaid, for example. So examples: billing for unnecessary medical services, misusing codes on claims, or unbundling, which is taking a code that is intended to cover multiple procedures and break it into pieces so you can bill those services individually. That's a no-no. Improper using of modifiers to obtain payment for services that otherwise may be denied. And we put a lot of faith in our billing folks at the CBO to really police the use of modifiers, because the payers will come back and take money if they think, or not pay money if they think the modifiers are being used incorrectly. And lack of documentation. And this is probably the biggest one that we're concerned about, is the documentation has to support the services that were submitted for payment. And the old adage is, if it wasn't documented, it wasn't done. And that's still true to this day. So one more time, Chris, what's the difference? Knowledge and intent. That defines what fraud is. And it's really one of those things that could become a criminal event if it's shown to be something done with knowledge and intent to defraud the government, be it state or federal. So fraud requires that a person has the intent to obtain a payment and the knowledge that the actions are wrong. So that's really what it's about, is people do these things knowing they're trying to fleece our taxpayer dollars. So teeth, yes, there's, any rule in our compliance plan has to have teeth. Our compliance plan that Medical Health Associates has, that is published in the resource file in the J drive, has teeth. And the teeth depend on the violation. And it can be as simple as retraining to as complex as imprisonment, money. If you're a licensed individual, you could lose your license. You could be prosecuted civilly or even criminally, depending on the situation. Oh, so Chris, what's my role? What's your role in this? Is that we want you to play a vital part in preventing, detecting, and reporting potential fraud, waste, and abuse. First, we all must comply with all obligatory statutory, regulatory, and other requirements, and there are a lot of them. Second, you have a duty to report any compliance issue, or at least ask the question if you suspect something isn't right. Third, you have a duty to follow, as I said earlier, the code of conduct, which is circulated for every new employee and also recirculated to folks, to all of us, once a year, to be sure we appreciate that we're all in this together. We're 8 minutes in. I'm halfway through already.
Good.
I probably should slow down.
Take a breath.
So we're going to do an audience participation question. Okay, Dawn, I got this. Step 1, start poll. Okay, here comes a poll. Okay. And the question is, publish. Okay, this is so much fun. Start poll. Okay, our compliance, Medical Health Associates Compliance Officer is the managing partner of your division, Becky Daniels, President of Medical Health Associates, the CEO, or Errol Flynn. Wow, look at this. They all got it right. Yes, you are absolutely correct. Thank you very much, because we only use it every year for the past 5 years. It is the CEO, is known as the compliance officer. I'm going to end poll, and I'm going to reset. Cool. Okay. Dawn just hit me. I shouldn't hit me. So what does New York State Medicaid expect? New York State expects us to train newbies and annual retrain for all of the existing staff, and that is exactly what we're doing today. To best conform our compliance plan, the good news is New York State came out with what's known as the 8 elements. The 8 elements is their way of helping us conform, and it's all about conforming to these rules that New York State has laid out as far as how we're going to comply with the expectations. 1, we're going to have written policies and procedures, and we do. Again, we do have a written compliance plan that is published and available for you to read. So the policy just lays out our expectation with regards to exercising due diligence, just a statement that we will not tolerate illegal, improper, or unethical behavior. and 2, to explain the process to how we're going to investigate issues if they come up. 2, oversight responsibility. It's the intention that all employees know who your compliance officer is, know that there is a compliance plan in place, and actually, did you know there's actually a compliance committee? The compliance committee in Medical Health Associates is comprised of a representative from each of the divisions, who the compliance officer reports to, and we meet at least 3 times a year to review the stuff that's going on, if any, with the compliance program, and also to talk about our internal audit, which we'll get to in a second. We're also required in element number 3 to train, which is, of course, what we're doing right now, and retrain. All newly hired employees get to see this lovely presentation, and then have the opportunity to ask any questions if they have any. Communicate. Open door policy. The door is always open unless it's shut. And what that means is, feel free, if you have a question or an issue that you want to raise, you have direct access to the compliance officer to make that question or make that complaint. And we can reach out to you if we have an issue via email or written requests or verbal requests, or sometimes we even use the community page on our Paylocity. So understand that we really want to keep an open door as far as how we communicate with you all. And just be aware, if you do have an issue, we will do our best. MHA will do our best not to divulge the reporting employee's identity. But as it may happen, depending on the extent of the issue, at some point it may come to pass of who raised the complaint, especially if it gets to some point where it's really like an illegal thing of some sort. Okay, and then anything else with regards to violations of laws or questions, that's what the compliance officer is there to handle. Audience participation question number 2, Don. Okay, start poll. Here it comes. Okay, publish. I shouldn't say the instructions, right? Okay, which compliance mishap could be implicated by changing a diagnosis code because a parent called and insisted it be changed so it would be covered by insurance? Okay. Oh, wow. Lee, what do you think?
I'll go with A.
Okay. And the answer is A. You're absolutely right. There's clearly a willful intent to fraud, I suppose. There clearly is a willful intent. Now, the real question is, would Medical Health Associates be committing fraud, or would the parent requesting this, demanding? Well, the answer is, I don't know. It would be up to the courts to decide. If we willingly said, yeah, fine, we'll get you paid, then yes, we would be conspiring to commit fraud. So either way, it would be a mess. And I think the key to remember when it comes to parents, and this happens if parents call and want to sort of force the issue, keep in mind, in my opinion, the more they push, the more likely it is an inappropriate thing to do. Certainly, if a parent has a question about a diagnosis code, it's completely appropriate for them to call and ask, and then an investigation can occur to see whether or not it is possible to change. But in no way should we ever conspire to the demands of anybody to change our medical record without it being in the document or going back to the provider and seeing if perhaps an amendment is appropriate. Okay, let's move on. Okay. Element number 5, disciplinary policies and procedures. Going back to that teeth emoji, we have to have teeth in our plan, and our Medical Health Associates compliance plan has teeth. And frankly, it's a function of the issue at hand. It may come down to just retraining or having a discussion, or worst case is to blatantly fail to comply with the rules, in which we could lead to misconduct and getting the law involved. And hopefully, knock on wood, I've never had that issue, and we want to avoid that. Okay. We also have to identify what we consider to be risk areas. Risk areas are, for example, things that MHA believes would be areas in which we would have the most risk of concern with compliance. For example, billing for items and services not documented. Yeah, I don't see how it could happen, but sometimes if a patient didn't show up, but yet the charge, for some reason, a provider clicked that the patient was seen and a charge goes out, we got a problem. Certainly didn't mean to do it, so it wouldn't fall into the fraudulent side, but certainly it could be considered abuse based on the definition. Lack of integrity of computer systems. As you know, medical health, the MedEnt system, knock on wood, 99.5% of the time it's up and running. And as you guys know, when it goes down, it's a mess. So that could be considered an issue from a compliance standpoint. Confidentiality of records. I did have a situation a year ago with an employee who accessed the medical record for the purpose of getting a phone number for a patient, and that patient found out that was the case, and we had to do an investigation to determine that indeed this was done, and we had to have a counseling session to correct the issue. Done, recognized, investigated, done, closed, move on. But it's a reminder to everyone that we are responsible for protecting the identity of our patients and their privacy. Failure to properly use modifiers. Again, modifiers, those little beasts, they can be a pain in the tush as far as which ones to use and when, but we're obliged to know the best way to do it. Also, we have to be cautious of discounts and professional courtesy. We can't just be giving write-offs to patients without a legitimate reason documented in the note. We are also prohibited to employ individuals who have been convicted of a criminal offense involving healthcare. And did you know that every month we run all of our staff through a service that double checks to make sure that we have not been involved with a criminal case of healthcare. All hires are subject to a background check, which we do. And every month, as I said, we do present and we scan our employees against the federal government database. Number 7, monitoring and auditing. Our compliance plan includes a provision where we do an annual audit of some sort, internal, external, for various reasons. In 2024, the board agreed that we're going to be doing an evaluation and audit of our HIPAA page. So in 2024, leadership will get together to review how the HIPAA page is being used in MedEnt and come to a consensus so that it can be done consistently throughout the whole company. Okay. Last but not least, non-intimidation and non-retaliation. MHA will not intimidate or retaliate against a clinician or staff person for reporting a potential issue. Of course not. Why would we do that? We need. It's like I said earlier. We're all in this together to protect the finite resources of the government. Audience participation question number 3, Dawn. That's this one right here. Start poll. Publish. Okay. So why is this session mandatory? Because Kathy and Chris say it is. Because protecting my providers and myself is important. Should say are important. Because protecting the New York State Medicaid program is important. Or all of the above. Oh, look at that. Probably the one person who's out there answered it. And you are absolutely correct, end poll. It is because all are important. And who's Kathy? Who's Kathy?
Governor.
Kathy who? Kathy Vero? No, it's spelled differently. Governor Kathy Holcomb. It's our governor. It's the law. And of course, your compliance officer says that as well. Last but not least, you'll be given an attestation by your department head. Please sign it and print your name so Dawn can know who you are. So she'll check you off. She'll check you off in the list, or else we have to come and find you and have you do it again. So please sign the attestation. Give it to your department head, and she will forward it, or he will forward it to Dawn. And I believe that concludes this. Are there any questions? Feel free to send a chat, and we'll give you a few minutes to see if there's any questions. Oh. Any questions from the studio audience? No questions here. So with there not being any questions after 19 minutes, I'd like to thank you for your time and for your attention to this important topic. The YouTube channel will be out shortly, and have a good day.